My name is Caroline Juguna. I'm your instructor today and will be performing the cardiovascular assessment. I will be going through the areas on how we can perform quality cardiovascular assessment on the patient. Okay, the first thing we want to do is to inspect the heart area, which is the pericardium, the outer part of the heart, and you want to inspect and see if we can feel the apical pulse, any pulsations or heaves. It's very important to have the patient seated upright on the table. Wash your hands. Make sure your hands are warm so that when you're touching the patient, they don't jump up or they don't feel your cold hands, and the assessment would go on smoothly. Next thing we want to do is palpate. And you see we're palpating the heart area, and we are palpating to feel the apical pulse, and we're palpating for thrills or leaks. It's very important when you're palpating, you start from the apex of the heart, you go to the left sternal border, and then you go down to the base. Palpation is important because this is where you can feel if a person has a heave or a lift. And when you're palpating, make sure that the patient is in a comfortable position. Again, your hands are warm, and touch lightly. And when you feel the cardiac movements, just massage around it to feel it. If you press on very hard, you might not feel the heartbeat properly. Okay, the next thing we want to do is to perform percussion. Percussion is it's mainly for you to estimate the normal size of the heart. Now, again, make sure your hands are warm. This assessment might be limited on some obese people. You might not be able to percuss the area of the heart, but this is just an estimate, and you'll be able to percuss the outline of the heart. It might be visually possible to do it. It may not be possible to do it on obese person. Okay, now the other thing, the most important part we're gonna do is auscultate the 5 areas of the heart. It's very important to know the 5 areas of the heart: the apical, pulmonic, Abs point, tricuspid, and the mitral. Well, you shouldn't limit it to the 5 areas, but mainly these are the most important part. And as you can see, the aortic valve area is located as the second right intercostal space at the right sternal border. The pulmonic valve area is located at the second left intercostal space at the left sternal border. The Abs point is at the third intercostal space along the lower at the left sternal border. The tricuspid is at the fourth left intercostal space along the left sternal border, and the mitral is at the apex of the heart. When you're listening, you're basically listening to the 4 heart sounds: the S1, S2, S3, S4. Those are the most distinctive heart sounds, and they should be characterized separately because the variations can offer important clues about the person's cardiac function. The S3 and S4 may not be present, and it's not an unusual finding. Although their presence does not necessarily indicate a pathological condition, but it's important to find out these sounds. Now, the S1 and S2 are results from when the mitral and tricuspid valve close. So It's best heard at the apex, where it's usually louder. Um, the splitting may occur when the mitral and the tricuspid valves do not close simultaneously. Sometimes it's not usually heard, but it's important to place your stethoscope correctly to find this sound. And you can listen using the heart or the bell or the diaphragm. And when you're listening, it's important to listen to any other heart sounds that don't sound like irregularly. You may have snaps, clicks, frictions, rubs, or murmurs. And when we are listening to these heart sounds, these are the things, the characteristics we are mainly listening for. The timing and the duration of the heart sound. How long are they? How long do they last? The pitch. Is it high? Is it low? The intensity, the pattern, the quality, the location, the radiation, and how they vary with the respiratory phase. These are basically how you'll assess when you're auscultating the heart sounds. That's the end of my presentation. If you have any questions, feel free to ask and we can go through them. Thank you.